Well, thank you very much for this kind introduction. I would like to welcome you as well cordially to the last day here at FIBO. My name is Sebastian Willert. I hold a diploma in sports. I obtained my PhD at the Institute for Medical Physics in the team of Professor Dr. Wolfgang Kemmler, who has presented several talks here over the past few days. My topic is weight management in EMS training, and our focus at our institute is also on alternative training technologies with a focus on EMS training. And this is why since last year we also launched a study on weight management. So we study the combination of a change in nutrition, a higher intake of proteins, plus EMS training on the muscle mass and body fat, so the composition of the body. Before I talk about this specific study in detail, I will, of course, also explain some of the background information. What does body fat mean? What about muscle mass? And, of course, also explain the reasons for this study and what needs to be considered to avoid the yo-yo effect and to not actually lose any muscle mass when you're losing weight. Then I will also present some study results, and they were produced at the Institute. With men. My study refers to women, as you will see a little later. And then I will talk about the study design. So this is really the nitty-gritty stuff. What should be included in a study in order to be able to present viable results. We started with 40 women last year. This is not enough in terms of numbers to provide you with solid evidence. And this is why we currently are in the second stage with 60 women, and I will conclude with the limitations of this study. In such studies, you always have to apply clear schemes. You can't adapt or make any individual adjustments, and to actually go full circle and be really realistic, I will conclude with this information. On the background of this study. This is known to many of you. Some of it will be refresher. What about muscle mass? This is the cross-section of a thigh. This is not a sports leg. If this was a sporty person, there would be less subcutaneous fat. So a young person, a little more fat, but inside the muscle as such, it does not really have fat veins. But when over time we don't do anything, then it would look like this. So the subcutaneous fat remains, maybe increases a little, but what you see, there are a little more fatty veins. There's more body fat, and you can see this change and a reduction of muscle mass and an increase in fat mass. So if we don't take care of us, then we're of course subjected to normal biological developments. So we're losing 1% of muscle mass every year, aged 30 and onwards. Some say even from the age of 25. And we increase our body fat with age. The good news is this is not a destiny. You can do something about it. You can control whether this happens or not. Of course, your metabolic rate slows down, and it's getting harder and harder to retain your muscle mass, but it is possible. There's this nice saying, the muscle never knows how old it is, so it adapts. You simply have to do something for it. And this is why it's so important to retain it, because muscles produce some positive effects. Muscle mass. Muscles not only look nice, aesthetic aspects. No, they have a meaning. This is logical. Muscles, of course, serves as motors. We can only perform in age, we can only move and do our daily routine when we have enough muscles. Without muscles, no movement. Then this is why many people start doing EMS to put burden off the joints. The higher the muscle mass, the lower the stress on the joints and on the vertebral discs. So muscles passively buffer the joints and the bones. And this should not be underestimated. Muscles are also metabolic organs. So when we move the muscles, and we have many muscles, then we can, of course, consume energy. The energy and filter this energy introduced by food. If I move my muscle properly, then nutrition is burned and we don't have this risk of diabetes mellitus. A tissue that is active, metabolically active, helps here. And this should not be forgotten either. Messenger substances, muscles serve as messengers. They actually produce hormones and hormone-identical substances. Whenever we move our muscles, then we release testosterone. Muscles are built, other hormones, serotonin, the happiness hormone is released. And only lately, we've learned that the myokines are released. This is hormone-like substances. And these myokines actually help vessels grow, and they actually help against inflammation. So the myokines released are basically the antagonists of the bad messenger substances released by visceral fat, the adokines that actually cause inflammations. And this is why belly fat, visceral fat, is such a big risk for diabetes, for instance. So we have a pharmacy in our body, and this is our muscles, and we should use it. And this is why it is so important to retain these muscles at any price. Also with diets, and I will also talk about the right diet to retain the muscle mass. And the next chart actually explains this. So if you have really gained some weight and want to lose it again, then you've got some fad diets. They work initially. Just a reduced calorie intake. But the problem is when you save too much, then the muscles not only lose fat but also muscle mass. Believing the studies, there's a big meta-analysis available for this. 2/3 of fat are lost, but unfortunately 1/3 of the muscle mass is lost in those quick diets as well. And this is why we actually reduce our metabolic rate at the same time. And through this lower burning, you actually reduce your metabolic rate. When the diet is over, sooner or later every diet ends. And if you actually eat exactly the same, then you will gain even more weight because you burn less. What you want to do is you want to lose fat because it is not metabolically active, but you want to retain your muscle mass. And this is why it is so important to ensure both things. But this is only possible through specific mechanisms that we need to consider. And this is these three. This is basically proven through studies. There are various ways to retain muscle mass and ideally burn fat. The mild calorie deficit, part of our study was that we actually only saved a maximum of 500 calories. So people only had 500 calories less than usually. If you reduce by more than 500 calories, then you run the risk of losing muscle mass, which you definitely want to avoid. Then this calorie deficit not only works through eating less, but you also have to move more. So this will also form part of the study. Second point. The media has taken this up again. Proteins do work when you increase the protein balance. When there is enough protein available in the body, then not the muscle mass will shed off, because the substance is available that actually retains the muscle, because muscles are primarily made up of proteins. And the third point, strength training or muscle training. Classically, we know this, when you move your body properly and you challenge your muscles, make your muscles burn, then the body actually needs these muscles and doesn't dream of reducing these. There's studies that have looked at individual parameters, but there are also studies that have looked at all of the parameters, and we will actually look at those. But now about EMS. What's the connection? Strength training does make sense to retain muscles, and our question was, of course, okay, alternative strength training is, of course, EMS, whole body strength training, BMS. It's this just as successful as high intensity training, HIIT training. This is a different audience. Our audience is women, obese women, 45 to 50. And here we've compared whole body EMS with HIIT, 1 to 3 training units, 20 to 30 minutes of training time, HIIT. And this was really full exertion training, 8 to 10 exercises, full load, next equipment, and quick training. We wanted to be slightly, almost as efficient as whole body EMS. 1.5 times EMS a week. Our studies are designed in such a fashion that we actually have 2 sessions every 2 weeks. Maintain the regeneration phase, first week Monday, second week Monday, Thursday. So in EMS, only half the time is needed. 30 to 50 years old men, untrained, and EMS can actually produce nice results. The lean body mass is a bit bigger with HIIT, but with whole body EMS, the figures are comparable. Between those groups, there's hardly any difference. Whole body EMS does work. So there is not a significant difference between HIIT and EMS for muscle buildup for men. And for body fat, EMS, again, is not lagging far behind HIIT training. So it makes sense to also include EMS training for weight management. The next study, it involved 100 men aged 70 plus. This is a really interesting clientele for such a study. We compared EMS with protein intake versus only protein intake and a control group. And this study did not include any calorie deficit. Same EMS protocol for 16 weeks. The plus protein group, and the effect is 1.6 to 1.8 grams per kilogram of body weight through protein pulver, and it worked even for men aged 70 plus. And they often say, well, above 70 there's nothing you can do, which is not true. Muscles can always adapt, even with men over 70, although young men, of course, will produce better results. In the skeletal muscle mass index, this is the muscles of the legs and arms as divided by the square meter. The control group, of course, remained the same. They haven't changed anything. And for body fat as well, in terms of percentages for the protein groups and the EMS training, we saw very nice results, although they were not told to reduce the calorie intake. They probably did this automatically because protein actually satisfies your hunger. The background? This is actually my topic, the randomized study for 16 weeks. The title of this study is Complicated Effects of a Whole Body EMS Training on the Energy Restriction-Induced Reduction of Muscle Mass for Desired Weight Reduction. Which means we have studied how does EMS impact the yo-yo effect if we want to reduce weight with a diet. And this is, we've designed the study to last for 16 weeks. This time, there was no pure control group, but there was a group that was just eating less and was given a little protein, 1.2 grams per kilo body weight. We analyzed the diet, and as soon as we saw that the balance was wrong, we actually added supplementation. Group 2, the deficit can be induced by a higher consumption or by less intake. So the group 2 only had a little less food, but we gave them a fitness tracker and also induced more movement. And they control themselves. And group 3, like group 2, eat less, higher energy consumption, plus EMS, plus proteins. The first results are available now, but we need more to obtain solid evidence. And this is why we're in the second stage now, where we train with 60 women again, 3 different groups. And we've started 2 or 3 weeks ago with the next group. To have a high homogeneous field, we wanted to have premenopausal women aged 25 to 50, and we wanted people with a body fat content of 28%, above 28%, so 28% or more, using the golden standard method. And this is the DEXA measurement, where you only measure bone density, but to the gram you can also determine muscle mass and body fat. And exclusion criteria were drugs, for instance, diseases, no factor that could have impacted the muscle mass, or cortisones, for instance, or pregnancy was excluded, which, after all, the study takes 16 weeks, so you can't really do EMS with pregnant women. This is a no-go. And everything, all of the factors that exclude EMS, like cardiac disorders or the like. To be more precise, energy restriction in group 1 by 500 calories, which is just a mild restriction. So the body fat loss in all 3 groups could have been expected. Maximum restriction through carbohydrates. This is easy because you don't have the blood sugar fluctuations. So we only reduced and supplemented with 1.2 grams. The second group, we restricted the energy intake by 250 kilocalories, but we also increased the energy spending. So we gave them fitness trackers, measured the kilometers they actually did, and we measured how many steps they had to take to spend 250 kilocalories. The protein was a little higher, 1.7 grams, and group 3 was like group 2. Whole body EMS training, the way we know it. So we had the 1.5 training units for 16 weeks, then 12 to 20 minutes per session. Because of the overload with the CK values, we actually reduced it and started with 12, 14, 16, 18, and then actually went up to 20 minutes. But from 20 minutes, when we knew that nothing could happen, we really went full speed ahead. But of course, always focusing the quality, focusing on the quality. The 85 hertz was the same, the 8 to 10 easy exercises in a standing position, 1 to 2 sets with 6 to 8 repetitions. Important that we also stayed in a 1 to 2 set because we really wanted to have safety first. Then protein supplement, this is what I already mentioned. We want to supplement just in case there was not enough protein in the diet with a multi-component protein. And initially we did a diet analysis. We asked our students or the trained subjects to hold a diary to give us the information how many calories are burnt, how much protein is taken in. And we told those subjects that they should actually write the diary for 5 typical days, so the everyday routine. And energy restriction was limited to carbohydrates. Walking, the tracker data, we had a fitness wearable very easily and asked the subjects to synchronize to capture their steps, the basal steps. And this was also the main problem, the increase in step numbers. It was so hard for the people to actually walk 7,500 steps in addition, because there were many office people involved in the study, and it was very hard for them to integrate these additional steps into their everyday life. So this leaves room for an optimization of the study design. So depending on the weight, people even had to integrate an additional 9,000 steps, and the heavier people 6,000 steps. The measurements, we're really happy that we work in the medical physics department because we have access to high-end equipment for doing this. So there are no the usual bioimpedance disorders or distortions. We use the high-end method regarding body fat and muscle mass composition. And we can even see the skeleton and outside the skin and the envelope, so to speak. And on the interfaces, we can see exactly how much muscle mass is there and how much body fat. In the legs, in the trunk, in the arms, and we could even focus on the visceral fat, which is a very good piece of information for us. And blood fat values were also measured, but that's a different story. And of course, leg strength measurements were taken. We can skip this really. We can say we have a homogeneous field or cohort of subjects, both regarding the BMI and the energy intake. Regarding limiting factors for this study, and this is also the overall limiting factor, which we have to get rid of after the second stage in August, the dropout rate. This is the control group. This was just the nutrition group. EMS actually created a strong loyalty. There were 2 pregnant women, unfortunately. This happens at that age. So loyalty was good. Energy restriction worked fine, although there was too little time for the people to always track it. For 16 weeks, it is so hard to keep a diary on whatever you eat. This is so painstaking for the trained subjects and for us. And thirdly, when people keep a diary, they, of course, change their diet anyway. So we hope that they would really implement our briefing, and we measured them afterwards to check whether they really did it. But what they did during the 16 weeks is a different story. When you work with humans, I mean, there's always the human factor involved. And there's the problem I just mentioned, the 7,500 steps. The walking protein group, group number 2, only increased the number of steps twice. The EMS group was a little better, but there was still 3,000 steps missing. So in the net balance, in the protein group, we had a higher deficit in that group than in the other 2 groups. In other words, maybe it makes more sense to combine EMS with nutrition, with the right diet. So instead of increasing activity. So this is the message. The protein intake, that worked fine. We saw this in the diet protocols. Then the adherence was very good. Everybody achieved the 100% because whenever somebody couldn't attend, we offered them replacement sessions. Subjectively, on a scale of 10, they trained pretty hard to obtain this promising effect. And these are the results, preliminary results, I should say. Significant, proven results. Body fat was lost in all 3 groups, 2.5 to 3 kilograms. The EMS group is slightly ahead. This could have been expected because we had the calorie restriction. But EMS saved. It is quite surprising to see that EMS produced a better result, although the EMS candidates couldn't actually add enough mobility. It's probably because they use up more calories in EMS. In the introduction, I mentioned the visceral fat, the abdominal fat, which is so important. And here you can see the percentage point change. Again, EMS is ahead. It produces the highest benefit. So especially the adverse visceral fat has gone down. So this is a health issue. So a smaller risk for any other disease. We need more people here. We had such a spread. We need more people, and this is why we will add or retrain another 60 people in order to show that EMS makes probably or more sense than HIT, or HIT makes more sense than EMS for fat-free mass, the LBM. We can see slight trends. All 3 groups didn't lose any muscle mass or hardly any muscle mass. EMS produced more muscle mass, just 0.5 kilo, which is not a lot. And in the leg and arm muscles, EMS again is the leader. But we have to wait to get better results. In August, we will be ready to say more. So, the summary and outlook. In all 3 groups, we posted a significant weight reduction, but no reduction in muscle mass, only very slight trend. The nutrition-only mass only lost a little muscle mass, so maybe the 1.2 grams of protein as a supplement are enough to retain the muscle mass. But this is difficult for people to introduce in their regular diet. Very few added the 1.2 grams. The DEG, the German Society for Nutrition, actually recommends 0.8 gram per kilogram of body weight. So we need more evidence. And this actually bridges the gap to the next presentation by Jens Vatter. And this means practical requirements. From the study side, of course, we have to follow the scheme. We have to be very strict. So after the study stage, we've understood, well, maybe just optimize the diet more. Unfortunately, we opted for this design, and we now have to stick to this original design. We have to prove our thesis or not prove it. But one-to-one training, the private setting in a normal studio, of course, is more efficient. And you have to follow up people. Of course, we trained with the people, but half an hour we talked to each other, but the individual adaptation was not possible. We simply tried to follow our method. So after we actually used a one-fits-all strategy. We gave them like golden rules for nutrition, but we couldn't expect everybody to actually count calories. Maybe a special support by a nutrition expert would be recommendable. So regular adaptation will probably produce even better results. And maybe for the next study, we should probably focus more on the diet and forget about the adding of more steps per day. But Jens, I guess, will comment on this. Okay, that was it for me. I would like to thank you for coming, for listening. And if you have any questions, I'm available in the corner over there. Thank you.